Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The purpose of this television tape is to demonstrate clean technique as described in the Clinic Procedures Manual. The objective of clean technique is to decrease the risks of autogenous and cross-infections due to the practice of dentistry. At the beginning of each operating period, it is important to determine that the cubicle is clean and dust-free. Any areas which are not clean and contain dust should be cleaned with Lysol in water or other household detergent. Then you would want to begin dispensing your paper goods. First, along the back counter here, dispense some paper bracket tray covers. You may also want to have a thumb forceps in a sterile packet for the transfer of any instruments out of your drawers. Also, it would be a good idea to have a paper bag attached with tape to the counter to be used to dispose of any gauze, cotton rolls during the treatment of the patient. Moving on to the headrest, place a headrest cover over it. Then, going on to your bracket tray, a piece of paper should be placed around the entire bracket tray. Then a bracket tray liner is placed inside. The instruments are organized on a rubber mat, and any other products such as gauze, cotton rolls can be placed on the tray. Going to your light, the light handle should be covered with paper toweling, which is attached with paper clips as so. The hand pieces are attached via the couplings and placed in their appropriate bracket tray holders. Saliva ejector. The air-water syringe at the beginning of each operating period should be turned on. That is, allow water to run through the air-water syringe for about 30 seconds to allow for the removal of any organisms which may have collected in the air-water syringe overnight. If a high-volume evacuator tip is used, it should be placed in the HVE coupling. This should not be placed on the bracket table. The coupling, evacuator hose is out of the clean technique area. Therefore, this should be left in your unit. In order to prepare for your patient, be sure that access to the chair is easy for them. To do this, simply move your bracket tray out of the way, your light out of the way. Then underneath the chair arm, there is a lever that or a button that you push and raise the arm. You are now ready to seat your patient. Place the patient's napkin and then do some initial adjustment of the headrest. And again, depress your button and the chair arm can be replaced. Now you are ready to begin your hand washing procedures. washing is done by applying red soap to your hands and lathering for a couple of seconds. Follow this by a few second rinse. This procedure is done 3 times. Let me show you. First, apply some red soap and thoroughly scrub your hands. Rinse for a few seconds. Repeat this a second time. And one last third time. When done correctly, this takes no more than about 15 seconds. When you have finished washing your hands, shut the water off by using your elbow rather than your newly washed hands. After drying your hands with paper toweling, throw the paper towel in the waste receptacle by kicking in the door rather than using your clean hands. You have now finished the hand washing procedure. There are just a few things that I would like to point out while you are treating the patient. Remember that your hands have just been cleaned and do not touch areas that are outside the clean technique area. For example, with the high volume evacuator, it is fine to touch the coupling, the evacuator tip. The hose is out of the clean technique area. During treatment of the patient, should it become necessary to answer the telephone, go away from the operatory, if you touch any areas that are not considered disinfected, then upon returning to the operatory, you should follow the hand washing procedure again. Also, during your treatment of the patient, should you need to adjust your glasses, please use the back of your arm along the side of your glasses to do so. Do not use your fingertips, as this again is violating the clean technique procedure. During the patient treatment, as gauze and cotton rolls are dirtied, it is best to immediately dispose of them. This can be done by simply discarding them in the paper bag that you have placed at the back of your cubicle. If you need to reach for an instrument from a drawer, use the thumb forceps in the sterile packet. Simply remove the forceps, open into your drawer, remove the instrument, transfer it to your bracket table, and replace the thumb forceps. Keep these simple points in mind while you are treating your patients. Do not break clean technique. After the paper goods have been disposed of, you are ready to begin your surface disinfection procedures. In order to accomplish this, we will use an iodine surgical scrub. This is a mixture of iodine surgical soap in alcohol. There is 1 part iodine surgical scrub soap in 20 parts of 70% isopropyl alcohol. This is to be used in conjunction with paper toweling to disinfect the surface areas in the operatory. Let us first consider the handpieces. All handpieces should be sterilized in central sterilization when possible. During morning and afternoon clinic sessions, if complete sterilization is not possible, disinfection with the surgical scrub can be done as follows. Take a paper towel and apply some of the scrub to it. First, the electrotorque and low-speed handpiece. Clean the electrotorque as so. The contra-angle should then be cleaned. Repeat this procedure by reapplying more surgical scrub to the paper toweling. The high-speed handpiece should be done similarly. Apply more surgical scrub. Remove your handpiece from the coupling. And clean it as so. Don't forget to slide the air-water tip down to move it out of the way to allow for cleansing underneath and around the burr. And then it can be pushed back into place. Repeat this procedure again by applying more surgical scrub to the paper toweling. This paper towel then should be discarded. Moving on to the bracket tray, apply surgical scrub to a new paper towel. Take your couplings and again cleanse around them. And don't forget to get in the area of the bracket tray holder. And again around the bracket tray holder. Similarly, the saliva ejector coupling should be cleaned. The knob for adjustment and the coupling itself. More surgical scrub should be added when moving on to the air-water syringe. The air-water syringe should also be depressed, turned on for 30 seconds to allow water to stream through the syringe to remove any aspirated microorganisms that may have been aspirated during the operatory procedures. Then again, this tip should be wiped and then the coupling cleaned. And the air-water syringe replaced. Lastly, more surgical scrub should be added to the paper toweling and the bracket table itself cleaned. Moving on to the bracket table lever, clean that. Then this paper towel should be discarded. A new paper towel is then used to clean the lamp handle, light intensity switch, light adjustment, and the chair. Take and simply clean around the lamp handles. Your light switch, the intensity control knob if you have used it, the chair control buttons, And this is much more simply accomplished if there's plastic lining them. Lastly, the chair arms should be cleansed. The chair adjustment lever and the other chair arm. Then this paper towel is discarded. Our last area of concern would be the back of the operatory. To accomplish this area, apply more surgical scrub to a new towel and simply wipe down the area. This may require a couple of applications. Don't forget the drawer pulls. Any drawers which have been opened should be so cleaned. This same procedure can be done with any medicament bottles by, again, just wiping the bottles with your paper toweling that contains the surgical scrub mix. This concludes the demonstration of surface disinfection. These procedures should be done after each patient, and you will be expected to follow them. The last thing we'd like to talk about is general housekeeping of the operatory. As mentioned earlier, any surfaces that are full of dust or that need cleaning can be cleansed with Lysol in water and paper toweling. This would include such things as the patient's chair, the operating stool, the back of the cubicle, anything that needs to be cleaned of dust. Next, it is important to flush out the high-volume evacuator and saliva ejector lines. Now this can be done by placing in a sink some Lysol and filling the sink with water, or by using an empty can as shown here. It will be dependent on whether the particular unit you're using will stretch, if the hoses of it will stretch over to the sink. Now what you want to do is check the back of the cubicle, the bottle that this will rinse into, and let me show you that. Here is the bottle in question. The first thing that you would want to do is to turn on your high-volume evacuator. Then all you do is simply set it in the water, Lysol water, and let the water run through the unit. You continue to do this until you've used the entire can of water, and you will see that the water in the bottle behind the unit becomes clear. Similarly, you turn on the saliva ejector and do the same procedure. Run it through the can of Lysol water until you see the jar water becoming clear. And then again turn off the ejector. Now remove the saliva ejector and take the top portion off. This will expose a small screen. This screen should be removed by simply taking a thumbnail underneath it and gently lifting it out. This should then be taken to the sink and cleansed, which we will do in just a couple minutes. We would also want to remove the jar to clean it. To do that, turn your high volume evacuator on completely. Then turn your jar counterclockwise. In so doing, you will hear a rush of air, and as you hear that, slowly press down to release the pressure and continue unscrewing until you can completely remove the jar. A screen attachment also comes off with your jar. The jar and screen, along with your saliva ejector screen, can then be taken to the sink to be brushed with a toothbrush and thoroughly cleaned with red soap, then dried. You are now ready to replace the cleaned screen and bottle. Do so by first placing the screen back into position, like so. There's a little attachment up under the top of the bottle in which it fits. It's off to the right. Then take your bottle and be sure that it is on straight. It's now on crooked. You want to remove that and get it on here straight. And turning clockwise, place the bottle back on. The bottle is now again ready for future use. Be sure that the bottle is on tightly, or the next operating period when you turn on the high volume evacuator, you'll hear a loud thud because it'll drop off. So be sure this is on very tightly. After you replace the bottle, you may now replace the small saliva ejector screen that you have cleaned. Do so by just replacing it at the top of the saliva ejector coupling and then reattaching the top part of the saliva ejector. This concludes our demonstration. The high volume evacuator line and saliva ejector line should be cleaned daily. You will find that this will greatly improve your suction quality. At the end of the operating day, make sure that your chair is in an upright position. The dental unit should be retracted and the door closed. Do not stockpile papers in your operatory. This is a breach of clean technique. You will be dispensed a bottle of iodine surgical scrub. As you run out of solution, simply return the bottle to central sterilization and you will be given a new supply of this mix. Remember that the operatory is a reflection of you. Thank you.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.